Hello and welcome to another episode of 5 Point Digital Health by HI Rapid Lab Public Health Foundation of India. Each episode covers 5 significant points on a variety of healthcare topics with focus on digital health systems and services. This episode is supported by American Leprosy Missions. Please read the disclaimer carefully and then watch the video. This video episode is a discussion on neglected tropical diseases, NTDs in short, the role of water, sanitation, hygiene or WASH in short, and the role of health access. So what are neglected tropical diseases? About 21 diseases are listed under NTDs as shown in the slide. Let me read the list in alphabetical order. Buruli ulcer, Chagas disease, chikungunya, dengue, dracunculiasis, echinococcosis, trematodiasis, trypanosomiasis, leishmaniasis, leprosy, lymphatic filariasis, mycetoma, onchocerciasis, rabies, scabies, schistosomiasis, helminthiasis, snakebite envenoming, teniasis, trachoma, and yaws. These names might sound strange, but several people may be more familiar with the common names that these diseases are known, like elephantiasis, river blindness, Hansen's disease, guinea worm, hookworm, whipworm, African sleeping sickness, etc. The reason these diseases are called neglected is because they generally affect the world's poor and historically have not received as much attention as other diseases like, let's say, HIV/AIDS, malaria or tuberculosis. To be more specific, neglected tropical diseases tend to be more common in people who live in regions of the world or in areas of countries where water quality, sanitation and hygiene, access to healthcare are poor. The World Health Organization estimates that more than 1 billion people, approximately 1/6 of the world's population, suffer from at least one NTDs. The diseases are prevalent in 149 countries. The 10 countries that are burdened with the most number of people with NTDs are shown in the slide: Mali, Cameroon, Tanzania, Mozambique, Ethiopia, Democratic Republic of Congo, Nigeria in the African continent, and Myanmar, Indonesia, and India in Asia. Although India has a large number of people suffering from NTDs, not all diseases are prevalent. The accompanying slide shows the disease-wise percentage of people affected from India in comparison with global numbers for that particular disease. Diseases like leprosy, leishmaniasis, dengue, trachoma, rabies are comparatively more prevalent in India than diseases like echinococcosis, trichuriasis, rabies, which are relatively less prevalent. Reliable disease prevalence data is not available for several diseases like Chagas, mycetoma, yaws, and others as shown in the slide. Even within India, there are substantial variation in the number of people suffering from NTDs between states. States with high prevalence of NTDs include Bihar, Uttar Pradesh, Madhya Pradesh, Andhra as shown in the accompanying image, while other states relatively have lower prevalence. While NTDs rarely lead to death, they can cause significant lifelong disability including fatigue, blindness, and sometimes disfigurement. Kids who suffer from NTDs may miss school, adults who suffer from NTDs may be unable to work or are too embarrassed to seek medical care. By diminishing quality of life and opportunities to succeed in life, NTDs can worsen the cycle of poverty among the world's poor and disadvantaged populations. To be specific, poor will get poorer because of NTDs. Hence, we should aim to stop the disease or minimize the effect of NTDs on people's lives and livelihood. Let us start with understanding the cause first. Parasites, viruses, bacteria, protozoa, and fungi can cause neglected tropical diseases. Trachoma, yaws, leprosy, buruli ulcer are caused by bacteria. Rabies, dengue, and chikungunya are caused by virus. Mycetoma are caused by fungus. Majority of NTDs like Chagas disease, dracunculiasis, echinococcosis, trypanosomiasis, trematodes, African trypanosomiasis, leishmaniasis, lymphatic filariasis, onchocerciasis, schistosomiasis, soil-transmitted helminthiasis are all caused by parasites. We have made detailed videos of diseases like dengue, chikungunya with discussion points about the presentation, causation, home care, treatment and prevention in English and Telugu. You can watch them by clicking on these links. We will make more such videos on each of the neglected tropical diseases in the near future. We know that NTDs rarely lead to death, but they can cause significant lifelong disability, including fatigue, blindness, and sometimes disfigurement. We also know that more than 1 billion people suffer from at least one NTD, and they are more common in people who live in regions of the world or in areas of countries where water quality, sanitation, and access to healthcare are poor. So let us try to understand the relationship between NTDs, wash, and access to healthcare with a very simple matrix grid illustration. Let us start with the family and consider two types of situations. One, where the family lives in an area with clean water and practices good sanitation and hygiene. Situation 2, another family that lives in an area with access only to contaminated water and poor sanitation and poor hygiene practice. Neglected tropical diseases or NTDs are more likely to affect the family in situation 2 than in situation 1 and cause disability, disfigurement, and possibly death. The family in situation 2 can be infected by parasites, viruses, bacteria, protozoa, and fungi that thrive in contaminated water present in lakes, streams, ponds, rivers, public water supplies, wells. When they use contaminated water for daily activities like drinking, bathing, washing clothes, and utensils. Other possibilities of getting infected could be through open defecation or eating poorly washed or cooked vegetables, fruits, or food or eating without properly washing hands, especially after defecation. Let us add one more consideration with the two additional variations. Situation 3, there is access to health facility, and situation 4, there is no access to healthcare facility. Most NTDs are chronic, insidious in progress, and require continuous long-term clinical management, almost resembling chronic disease conditions. The family affected by NTDs in situation 3 can possibly manage NTDs, whereas a family in situation 4 has very limited possibility of managing NTDs, again leading to disability, disfigurement, and possibly death. Obviously, reality is not as simple as what we have shown here as a simple matrix grid illustration, but we do have a framework to understand the relationship between NTDs, wash, and access to healthcare. There are several more mediators for NTDs, including housing status, environment, built and natural, migration, and poverty. Reality, as we all know, consists of several unique variables. Special mention should be made of the fact that women are more vulnerable to NTDs as they are more likely to carry out activities like collecting water, washing clothes, utensils, and cooking. According to WHO and UNICEF, water problems are women's problems as women shoulder the largest burden of collecting water globally, accounting for 64% of collection as opposed to men who perform 24% of water collection. Girls are engaged in 7% and boys 4% of water collection. On the positive side, educating women on good wash habits can be a force multiplier as they are not only key practitioners of sanitation and hygiene at home, but they can influence the next generation by what they practice at home. Children are also vulnerable to NTDs. Children are biologically vulnerable to infectious diseases like NTDs and their impacts as they are exposed to microbial threats through play, work, and substandard living conditions. They are more vulnerable than adults to environmental exposures and developmental stresses because their immune systems are not fully developed and their developing bodies are biologically more susceptible to the effects of infection-related environmental assaults like NTDs. Let us continue to the next point. How to eradicate NTDs or manage the disease or minimize its effects, possibly with digital processes. Let us revisit our matrix starting with the family, then wash, then health facility access and outcomes of NTDs as per our matrix. There are three possibilities for intervention to prevent the family from suffering from the outcomes of NTDs. 1. Bring healthcare close to the point of need, which is the family, or specifically the household of the family, which is improving health access to healthcare. 2. Ensure good wash facilities. And 3. Educate the family to understand and follow good wash habits and if necessary, reach out for healthcare facilities. To these possibilities, let us add 3 levels of interventions. 1. Policy level, 2. Community level, and 3. Household level. So now we have a NTD wash health access management matrix. To summarize, we discussed about neglected tropical diseases or NTDs, knew why they were called neglected, the effects of the disease, which is disability, disfigurement, or death, the role of water sanitation and hygiene or WASH, and the role of health access. We developed two matrices, a relationship matrix and a management matrix. In the next episodes, we will expand on the management matrix and bring you best practices to manage NTDs across three levels: policy, community, and household, with a specific focus on rural, remote, and resource constrained ecosystem that people suffering from neglected tropical diseases live in. We will also specifically focus on digital initiatives. I'll show you a few images of the villages where people with NTDs live to understand their ecosystem. These images and infographics were taken and developed by my team at HI Rapid Lab as part of our fieldwork on NTDs, WASH, and health access. The script of this video will be made available on websites www.daraonline.com and www.hirapidlab.com with due references. Please visit them for further information. Thank you for watching this episode.